What is chemotherapy? Chemotherapy, often referred to as chemo, is a type of cancer treatment that uses powerful drugs to destroy cancer cells. It is one of the most common treatments for cancer and can be used alone or in combination with other treatments like surgery or radiation therapy. Chemotherapy is a powerful treatment for cancer. It works by targeting and killing rapidly dividing cells, which include cancer cells. However, it can also affect healthy cells that divide quickly, such as those in the hair follicles and digestive tract. It uses special drugs to kill cancer cells. These drugs are carefully prepared and administered by healthcare professionals to ensure the correct dosage and minimize side effects. These drugs work throughout the body. They travel through the bloodstream to reach cancer cells wherever they may be, making chemotherapy a systemic treatment. Chemotherapy is often given in cycles. This means you receive treatment for a specific period, followed by a rest period to allow your body to recover. This means you get treatment for a period of time, then take a break. The length and frequency of these cycles depend on the type of cancer and the specific drugs used. Chemo can be given in different ways. The method of administration can vary based on the type of cancer and the treatment plan designed by your healthcare team. One way is through a needle in your arm. This is known as intravenous IV chemotherapy and is one of the most common methods. Another way is through a pill you swallow. Oral chemotherapy allows patients to take their treatment at home, which can be more convenient. The way you get chemo depends on the type of cancer you have. Your oncologist will determine the best method based on your specific diagnosis and overall health. Chemotherapy is a team effort. It involves a coordinated approach from a multidisciplinary team of healthcare professionals. Doctors, nurses, and other healthcare professionals will work with you. They will monitor your progress and adjust your treatment as needed to ensure the best possible outcome. They will create a treatment plan just for you. This personalized plan will take into account your specific type of cancer, overall health, and personal preferences to provide the most effective treatment. How does chemotherapy work? Chemotherapy drugs attack cells that grow quickly. Cancer cells grow quickly, so chemo targets them. Unfortunately, some healthy cells also grow quickly. This is why chemo can cause side effects. Chemo drugs travel through your bloodstream. They reach almost all parts of your body. This helps kill cancer cells that may have spread. Each type of chemo drug works in a different way. Some drugs damage the DNA of cancer cells. This stops the cells from growing and dividing. Other drugs prevent cells from making new DNA. Types of chemotherapy. There are many types of chemotherapy drugs. They are grouped by how they work and what cancers they treat. Your doctor will choose the best drugs for your type of cancer. Some common types of chemo include alkylating agents. These drugs damage DNA to prevent cancer cells from growing. Antimetabolites. These drugs interfere with DNA and RNA, which are needed for cell growth. Plant alkaloids. These drugs come from plants and interfere with cell division. Chemotherapy can cause side effects because it can harm healthy cells. These side effects can be challenging, but understanding them can help you manage them better. Side effects vary from person to person. Factors like age, overall health, and other medications can influence how you react to chemotherapy. They also depend on the type and amount of chemo you get. Your healthcare team will tailor your treatment plan to minimize side effects as much as possible. Some common side effects are nausea and vomiting, which can be quite distressing, hair loss, which can affect your self-esteem, and fatigue, which can make daily activities more difficult. Your doctor can give you medicine to help with nausea and vomiting. These medications can significantly improve your comfort during treatment. Hair loss is temporary, and your hair will grow back after treatment. You might notice changes in texture or color, but it will return. To manage fatigue, try to get enough rest and eat healthy foods. Regular light exercise can also help boost your energy levels. It's important to tell your doctor about any side effects you have. Open communication helps your healthcare team provide the best care. There are things you can do to prevent and manage them. Your healthcare team will provide you with strategies and support to help you through this challenging time. Chemotherapy is a powerful tool in the fight against cancer. It involves the use of drugs to destroy cancer cells, which can be administered orally or through an IV. It can cure many types of cancer, providing hope and a new lease on life for many patients. It can also shrink tumors and slow cancer growth, making it easier to manage the disease and improve the quality of life. This can improve symptoms and help people live longer, allowing them to enjoy more time with their loved ones. Chemotherapy is often used with other treatments, like surgery or radiation therapy, to increase its effectiveness. This is called multimodal therapy, which combines different methods to attack cancer from multiple angles. The effectiveness of chemotherapy varies depending on the type and stage of cancer, as well as the patient's overall health. Your doctor will discuss your individual outlook, taking into account your specific situation and treatment options. Chemotherapy can be a challenging journey, with side effects that can be difficult to manage. But remember, you are not alone. There are support groups, family, and healthcare professionals ready to help you through this process. With the right treatment and support, you can get through it. Stay positive and keep fighting, because there is always hope.